This is plastic surgery before and after.
A facial deformity can make a child's life miserable. And in many impoverished countries, plastic surgery simply isn't available. But we're about to meet a group of surgeons who volunteer their time and skills to improve children's lives.
Dr. Babak Azizzadeh, a Beverly Hills plastic surgeon, arrives in Quito, Ecuador on a mission of hope.
Medical Missions for Children is a nonprofit organization that was established in 1990 with a group of dedicated surgeons, nurses, and ancillary staff who treat patients from very impoverished countries, kids who really have no other options for their craniofacial deformities.
We're going to spend about 7 days here in Quito, and the majority of the days are going to be spent operating on kids who have craniofacial deformities such as cleft lip, cleft palate. ¿Cómo estás?
News of the doctor's arrival in Quito spread quickly. The waiting room at the Fundación Tierra Nueva Hospital is filled with parents hoping their children will be chosen for surgery.
Jessica Vázquez.
Today, over 100 children will be screened,
Hola.
including 2-year-old Anderson Roca.
Oh, gracias.
He was born with a cleft lip and palate, which has seriously affected his health.
Anderson weighs approximately 15 pounds, and that's a third less than what a normal 2-year-old should weigh. He has severe malnutrition.
My child's main problem is that he can't feed himself normally. My son likes to eat like any other child.
Roca, Anderson.
Hola!
His mother Yolanda brings Anderson to the Medical Missions Clinic, hoping he'll be selected for surgery.
Does he have a pediatrician or a doctor that takes care of him?
¿Tiene un pediatra o un médico que lo cuida?
No.
Okay.
Because he is malnourished, Anderson undergoes an examination to make sure he is fit for surgery.
35 respiration.
An hour later, Dr. Azizzadeh returns with the final decision.
Okay, everything looks good, and I think we're definitely going to do the surgery this week.
Oh, de nada, señora.
Okay, great.
Estoy muy agradecida.
She just says, may God pay you for what you've done.
Oh, thank you, thank you.
3 days later, Anderson and Yolanda return to the hospital, ready for surgery. Today's procedure will repair Anderson's cleft lip.
That's going to be the challenge of the operation, to really get this lip to look perfect and bring the muscles together so that he could function well.
The doctor begins by making incisions to separate the tissues from the muscles in Anderson's upper lip.
We want to get total release of the muscles that have gone and attached to the wrong places. We're going to create a skin flap that's going to be rotated in and brought into this area, recreating the normal nostril. Once the two muscles are joined together and a scar band forms, then they become functionally one unit. We just finished Anderson's surgery. Everything went great. We were able to repair the lip, the nose. He really should look fantastic with a normal lip contour.
Hi! Chinito, todo va bien. Hola, Yolanda.
Now he returns for a post-op checkup with Dr. Babak Azizzadeh.
Basically, the lip has healed perfectly well, and the nose has come in. We've recreated the nostril, so we have much more symmetry between the nostrils. Anderson's exactly where we want him to be at this point, which is about 3 days after his surgery, so everything's healing great. Next year, we'll go ahead and fix the palate for his cleft palate deformity. And Anderson, you gotta come and give me a huggy. Okay, I'll give you a huggy with thing. Okay. All right. Okay. Good one.
Another child Dr. Azizzadeh saw on his first day
Hola.
was 5-year-old Dianna Muyo.
Dianna has a deformity called a lop ear deformity. Basically, when the ear doesn't develop appropriately, and the kids have really, really wide, over-projected ears.
Dianna's brother Henry was also born with a lop ear deformity. A year ago, Medical Missions for Children performed an autoplasty to correct the condition. Now, Dianna hopes her ears will look like her brother Henry's.
Before, after. Before, after.
This deformity creates an amazing, amazing social impact on kids' lives.
Dianna doesn't have an aggressive nature. If anyone says anything hurtful to her, she won't defend herself. She tells me about it later, and I'm the one that gets upset. They do like this, and like this, and they do like a sandwich. The other kids aren't going to do anything to me once I've been operated on. I'll be left alone once I get the operation.
Hola, Dianna. El doctor está listo, pues ven.
So our goal is going to be really to set the ear in on both sides. And the key with otoplasty, just like with when we do rhinoplasty, when the nose is very large, it stands out. And when the ears are very protruded, they stand out. All we want to do is basically bring the ears, just like Henry's ears, to a point where no one really notices any difference.
3 days after their initial consult, Dianna and her mother returned to the hospital.
Anacita, buenos noches, Anacita. Buenos noches. Okay, Dianna, buenos noches.
Dianna's autoplasty surgery begins.
So now we're going to do the Mustardé suture. When you tie it, it basically creates the fold. She now has a beautiful anti-helix.
Dr. Azizzadeh closes the incisions and prepares to repeat the procedure on the other side.
The key to the other side is going to be our ability to get it very, very, very symmetrical to this side. Everything looks really, really great. We're finished with surgery, and as you can see, she has a perfectly shaped ear with both a nice helix and a beautiful anti-helix. Sylvia? Hola! Todo bien. Finito.
Muchas gracias.
El normal oído.
Now, Dianna returns to get her bandages taken off.
All right. So the ears look very symmetrical. We've pinned back the ear to perfect position. And more importantly, the ears just don't stand out anymore.
The whole family is very happy she had the operation. She looks like me.
I'm very grateful to the American doctors that came to carry out the operation. They did a perfect job and left her ears looking like normal ones. I see her looking in the mirror, touching her ears. She's more confident now. She notices the change.